So let's start by talking about what vascular malformations are. These are a complex group of vascular lesions that arise by embryologic dysmorphogenesis without increased endothelial proliferation. And you'll understand the importance of that a little more when we get to talking about the difference between vascular malformations and hemangiomas or vascular tumors. So the background and significance of these lesions are that they can create incredible morbidity and even mortality for patients, and virtually universally, except for the most trivial lesions, cause extreme loss of quality of life. So when we're treating these lesions, what we're mostly talking about is mitigating the quality of life implications of these lesions. We rarely are able to cure them. Genetic data suggests that reduced ability to regulate the signaling processes responsible for proliferation, differentiation, maturation, adhesion, and apoptosis of vascular cells has an important role in the pathogenesis of congenital vascular malformations. And while you can't see these, of course, it just gives you an idea of the number of mutations that have historically been identified. Well, the area of vascular malformations is not exactly a hotbed of research in the vascular world, and I generally don't have a great deal to update on year to year, but this year actually there has been a very interesting development in the genetic profile of patients with the PROS syndrome, and I'll get back to that in just a second. So the PIK3CA related overgrowth syndrome, or PROS, has been found now to be related to the overactivation of the mTOR or RAS pathway that leads to the dysregulation of normal cellular functions, survival advantage in a negative way, like if you consider like a cancer cell survival advantage, and angiogenesis. And this is thought to trigger the development and or proliferation of vascular malformations, at least based on this mirroring model that this group has developed. So they used this mirroring model, found that that targeted molecules based on mitigating this pathway were very successful in the mirroring model, and then actually used it to treat patients. So if you look at this set of diagrams and images, you can see that over time, patients treated with this genetic manipulation therapy had a dramatic improvement in these complex malformations. And this is really, other than sirolimus, we've seen no medical therapy that has been this successful. So this is extremely exciting for those of us that treat malformations. So the pathophysiology we've talked about a little bit. I want to let you know the difference between truncular and extratruncular malformations, because that's going to be very important in our understanding of treatment. So truncular malformations, extratruncular malformations are the outcome of developmental arrest in the early stages, whereas truncular malformations are the result of abnormal development in the later stages. And so for truncular malformations, these are going to be malformations or abnormalities in named blood vessels. So persistent sciatic artery or mid-aortic syndrome would be examples of that. We won't be talking about that today. These malformations are generally treated with more standard vascular techniques. The incidence is about 1.2 to 1.5% in the general population, and of these, about 2/3 of these are going to be low-flow malformations, and 1/3 will be the high-flow variety. And high flow would be what you all typically think of as the AVM, or arteriovenous malformation.